Okay. So today we are going to start with the epidemiological research designs. Okay, so design is a very important part. And in the today's lecture, we are going to discuss regarding the different types of research, epidemiological research. We haven't started with research designs yet, right?
Exactly.
Okay. Okay, and then what are the classification of designs? What are the qualitative methods? What are the quantitative methods? And what are the choice of the various designs? Okay. So So see, epidemiological research will be based on, what type of a research you are going to do. Whether your research is lab based, okay. For example, you are working on some new COVID, genotype, where you want to see whether this strain is much more virulent as compared to the other strain. So there are different type of lab research or vaccine development. So lab research basically applies the knowledge of the basic sciences, whatever you studied in your preclinical, paraclinical, in terms of your anatomy, physiology, or in terms of animal sciences, and using those knowledge with terms of pathology. And you are using all these basic sciences towards the development of procedure and strategies to prevent, control, and understand the mechanism of the health related phenomena. For example, how the COVID vaccine is able to prevent any types of corona infection. So these type of research are known as the lab research. Is it clear? And second is basically your epidemiological investigation. For example, when corona was a pandemic, okay, and it became an epidemic. When it was an epidemic and it became an pandemic. For example, it is crossing all type of geographical boundaries, and it is reaching from one place to another. So we really need to understand the study of the outbreaks, okay. So we really need to understand the study of the outbreaks, and we also need to understand in terms of like just a minute. Yeah, so we need to see the study of the outbreaks in the local population to understand like what are the agents, what are the various transmission modes, and what are the possible control measures in order to control the spread of infection. And then the third will be an population based researches, where we are going to study all the population parameters in terms of what are the determinants, how the gender or the sex is going to affect the disease outcomes, what are the various control measures of the health related phenomena in a chosen population, followed by the application of what type of a biostatistical techniques, whether we are going to go for a parametric test, whether we are going to go for a non-parametric test. Parametric and non-parametric will depend on the type of variable you have, whether you have got nominal, ordinal, interval, or ratio variable. And these techniques basically, how can you generalize the results that you got from your studies? For example, how you can basically use those researches in understanding the phenomena at the various levels. So this is basically your population based researches. Is it clear? Are the three types of epidemiological research clear to you, which is related with lab research, epidemic investigations, and population based research? Yes.
Yes,
Yes,
sir.
of the okay, good. So now we come to the different types of data collection methods. So you all know there are two types of data collection method. One is the primary data collection method, and the second is the secondary. So primary is basically direct. For example, suppose you are the investigator, you are trying to see the surgical protocols during COVID-19 infection. So in a hospital, you are seeing what type of a protocols, the surgical protocols is being followed in the hospitals, whether it is different from the usual routine, or there is a change. If there is a change, then what type of a change is it? Okay, what are the implications of such a thing? And at the end of the day, what are the rewards or something in order to follow such a system? So one is your primary, where the investigator is firstly trying to collect the data. So the patient may have a questionnaire, the patient may the investigator may have a questionnaire. Or she can directly to the person and take the feedback regarding various elements of the things are concerned. Okay, but here basically in terms of so you can go and take an interview, you can observe it, and sometimes it may be so there are different advantages, except for like it can be quite slow and unfeasible since everybody may not respond to it very correctly. So this is the primary data. As far as the secondary data is concerned, the secondary data are those data where already we have taken some data in terms of some records, in terms of like your census, in terms of vital statistics, we have recorded it for, and then we use the same data in order to comprehend the things in a different manner and in order to correlate different aspect with the relation to the overall study that was previously been done. So any type of individual records, whether it's related with medical, whether it's related with employment, whether it's a census data, whether it's a vital statistic, whether it's a from the group in related. So these things will come under secondary data. Is it clear? Is primary is the difference between primary and secondary clear to everyone?
Yes, sir.
Okay, good. So what is our study design? So study design is a very important component, okay, in epidemiology, because through this concept, the understanding of the epidemiological designs won't be able to gain much. So study design is what? It is a specific plan, it is a way or it's a protocol for conducting a study. It is basically how we are going to conduct the study, which allows the investigator to translate the conceptual hypothesis into an operational one. So whatever you are thinking, how do we transform it in reality, okay, by working out the things and then working out the how would the speciality of that other person is going to help. So it is basically a specific plan or a protocol for conducting the study which allows the investigator to translate the conceptual hypothesis into a operational one. Is it clear?
Yes, sir.
Okay. Yes, Shivam, is it clear to you? Any doubt till now? Shivam, is it clear? Okay. Okay, Shivam. Okay, now the third one. So based on this, we have got different type of study design. As you can see on the study slide in the slides, we have got a qualitative design. We have got a quantitative design. Okay, we'll come to the qualitative and the based on the quantitative design, we have got experimental designs and we have got operational design, observational designs. Okay, experimental and observational. As far as the experimental designs are concerned, okay, and then observational will be based on the basic design, the hybrid design, and the incomplete design. We'll come to all these points. So we have got qualitative, quantitative. Under the quantitative, we have got an experimental and we have got an observational design. And observational design will be further divided into basic design, hybrid, and incomplete design. So let us understand first the qualitative. Uh, just a minute. Yeah, so as far as the qualitative design is concerned, quality, as you know, we are basically trying to understand a phenomena. That's why it is based on understanding. It can be related with your interview or observation. You are trying to discover a framework. This is basically quite theory generating. You are trying to explain the phenomena. Okay, here the quality of the informant is more infection is more important than the sample size. It is subjective in nature, then it embedded knowledge is there. And here basically as far as the analysis is concerned, there has to be some fidelity to the text, what is trying to mean, and how it is going to try, and how it is going to be measured in terms of the interview which we have taken from the other participants, based on which we are trying to assess a particular situation. Okay, that is basically about quality. So here everything is related with quality in terms of, okay, and here the meaning that we are going to generate, it is of immense value. As far as the quantitative research is concerned, there is basically an element of prediction. For example, if you have got a x variable, how does it correlate with the y variable? If the x variable is changing, how it is changing with the y variable? Okay, and similarly there are certain boys if you are going to work over there. So here basically it is numerical in nature. So based on whether you have got a nominal data, ordinal, interval, or ratio, particularly the interval and ratio, we are going to use this. And the sample size calculation is very, very important in quantitative data. So how do you calculate the sample size depending on the type of information you want to seek? And then it is basically used in the public domain. And here the most important mode of analysis are either parametric or non-parametric, depending on the what type of data you presently have. Yes, is the difference between qualitative and qualitative info. Is it
So what
clear?
is so what is the difference between parametric and non-parametric data?
Parametric analysis is that analysis which uses there are, see, in the world, there are four types of data: nominal, ordinal, interval, ratio. Nominal type of data is that data which is in yes or no. For example, there is a discrete content. For example, I might say, what blood group do you have? So there are only four categories: AB, and O. What is your gender? Male, female. So male, female again is either you are male, either you are female. Today, nowadays, there's another third gender, the transgender. Okay, so tomorrow we can, but this is a discrete content. That means either you are in group this, you are belong to group this, or you belong to group this. So we simply say, in the class of 60, how many males, how many females? So there may be 22 males and rest of the 48 females. So we may say we are all females. Okay, so that is type of male and female type of data is known as the nominal data. The second category of data is known as the ordinal data. The ordinal data is, suppose we are trying to calculate an order. For example, when the mill, for example, suppose you have got zero pain. That means on VAS scale, you have got zero pain. That is known as VAS. So zero pain means no pain, and very severe pain means 10. You rate it as 10. So you say, if I ask you, okay, how much is the pain in your knee? So today you have very high pain. So you might say, my pain is 7. My VAS score is 7. But after 10, 15 minutes, 20 minutes, you might say my pain has gone down. Now I say, okay, how much is your pain? So you might say it was only 10 minutes. So now when you are saying it is, so there's an order in this. Okay, it's because you are saying if the pain from say 3 it becomes 1, and from 5 it becomes 3. So you on you might say, actually, like 5 minus 3 is greater than 2 minus 1. Okay, because the pain over here is more, and the interest is more. So in all nominal and ordinal, the type of statistical test for doing an analysis will be your non-parametric test. Whereas the other type of scale, that is interval and ratio. Now interval and ratio is depending on those type of data where it is basically your interval and ratio. For example, like temperature. Now your temperature is 100.1, 100.2, 100.3. Now after giving medicine, I will say, ask how much is your temperature. So you are able to measure even after the decimal places. Okay, so that type of data is interval ratio. And then you might even say, like, what is the range of motion in a goniometer? Again, it is a interval ratio. So all the data where the type of or the classification of data is based on interval ratio, that type of data is basically is using the parametric test. The type of data which is nominal and ordinal, there we are going to use a non-parametric test. Is it clear?
Yes, sir.
Okay.
Yes, sir.
So based on this, the qualitative methods could be your, in terms of focus group methods, where we directly go and ask to the person indirectly about certain things. And okay, so we can focus on the focus groups. We can take interview from that groups. For example, you want to know the knowledge, attitude, and practice of the people living in Riyadh, or the doctors living in Riyadh. Um, uh, you are basically trying to see the particular group. You are trying to collect the data, so the information from that group. So that is a focus group. Or you can prepare a questionnaire and you can do an interview session and can ask specific questions. You can use the self reports, you can use the observation records, you can use the analysis part. Okay, sampling. So here the type of sampling we use is a purposive sampling. Again, the quality assurance again will depend on the credibility, conformability, transferability, and dependability. And as far as the authenticity, it has to be done with fairness and educated and typological mistake in Okay, so the type of data we are going to use is a purposive data, whereas in quantitative, again, the sampling. So there are different types of sampling methods. For example, how do you choose your sample? So whether it's a probability sample, it is a non-probability sample under the probability sample, whether it's a stratified sample or or a systematic stratified sample. So depending on the different type of sample, we are going to choose the study. Okay. So quality will always talk about, about a concept or a event, okay, whereas quantitative is very specific device or and it will based on the pure numbers. Is it clear?
Yes, sir.
Okay, so you need to understand the difference. So different type of quality, designs could be the other name for qualitative versus quantitative design is positivistic and phenomenological research. So
Mm.
phenomenological you can do. So as far as the qualitative data is concerned, so there is a, so one is phenomenological, other is a positivistic. Phenomenological is the other name for your qualitative data. Positivistic is the other name for your quantitative data, right? So as far
Mm.
as your qualitative research design is concerned, it can be ethnography. Now, ethnography is what? Ethnography is the description and the interpretation of a cultural or a social group or system. For example, we talk about the particular class, we talk about the particular group, we talk about the particular people, we talk about the social groups, we talk about the multiple interpretation of the same. So that is basically interpretivistic. And then you might have a biography. You can use a critical theory, you can present a personal experience. So these are all different types of qualitative research. Is it clear?
Yes, sir.
And then that means in qualitative research design, you will go to a particular place. For example, when the first team was writing about corona, so a simple person went to the patient, he observed the behavior of the patient response, and the observations were made regarding the same. Okay, then you take a specific interview, your questions are very direct and specific. You need to use a text, you need to do a survey, and that's how you do the user experience.
Okay, sir.
Okay,
Yes,
is it
sir.
clear? So basically we are observing over here. So for doing a qualitative study, we have to use four phenomena. That is, we are observing the things, we are conversing with the parts. For example, I'm asking you, how did you like the class? What type of problems you are facing? What are the strengths? What are the weakness? So if I ask about a particular class, so you will give your feedback. So that is all about observing, you are conversing, you are participating, and you are interpreting. Okay.
Yes,
So
sir.
there are four types of, so these are the four skills which are required in a research area. And then as far as the qualitative part techniques is concerned, I told you there are different techniques. One is the participant observation. In participant observation, what we do, we develop an understanding of the cultural aspects. For example, like we understand the patterns, we understand the type of atmosphere the patient is having, then that it depends on the to how they handle it. Then we take the interview of the people. From the interview, what you do, we try to make out like what are the positive causes, what is the effect, what is the impact of certain things about the same. Okay.
Yes, sir.
So we are doing interview, and we are doing a data analysis. So there are various themes. So there is a thematic presentation. Okay. And then there are surveys. You do a user testing and you try to extrapolate the results where you understand the phenomena. And in terms of phenomena, what type of advantage you will be getting, what type of a mindset or what type of a phenomena you are trying to evaluate the same. So you will get all these things through the qualitative analysis. So what is the rigor in the qualitative research? The rigor is dependent on dependability. How much the study can be correlated with the real time problem. Okay.
Okay, sir.
And then what is the credibility from where you have taken the reference source? What is the credibility of the information that you have taken, and what is the confirmability of the same? So you have dependability, you have got confirmation, you have got credibility, and that's why we are having your transferability, confirmability, credibility, and dependability. These are the four traits of your qualitative research. These are also referred to as the rigor or the important things.
Okay, sir.
Okay.
Yes, sir.
Then comes the quantitative design. Now, this is a very important part because quantitative design can be further, because now it is in quantity. We can calculate it, there is a number to it. Okay. So, observational design that do not involve any intervention or experiment. For example, here we are also doing the same thing. We are observing it, and based on the also observing, we are doing the calculation. Okay. Like, for example, how much has the grass grown over the last 2 weeks, how our body has responded. Okay. And what type of information it is going to give. So it also used the various boundaries in order to give the information, and based on those information that can be analyzed and can be predicted further.
Mm.
Okay, so you have got observation here. The studies do not do any type of intervention or experiment, but they do simply observation. The second is experimental study, where you actually manipulate, where you give something. For example, there are two drugs, A and B, and you have got fever. So I would like to see whether A does better or B does better, and both of them are new drugs. Okay, when you gave A, so the A basically caused some sort of rash, and then you develop starting another problem, and then now after sorting out all those issues, now you are better. So, but it is going to take time. So that is group A. Similarly, in group B, the same things can happen, but the person does much better and quite faster. Is it clear?
Yes, sir.
Okay, so one is observational, other is experimental. The third is like from where you are selecting the units, what is the sample population, what is the common group, what is the select group type, and then what is the study sample from where you are taking the study sample, whether you are going for a cross sectional study. If the cross sectional study is done, then it is basically you are taking one day, one time you ask the questions and form a format regarding the same. For example, like knowledge, attitude, and practice. Similarly, you can also study regarding the same in terms of the data collection techniques. What are the timings, what are the various ways by which we can collect the data, and whether the type of data is primary or secondary in nature.
Mm. Okay, sir.
Okay.
Yes, sir.
So cross-sectional study, in simple terms, it is known as the where you are I'm giving a questionnaire and you fill up the questionnaire, and I'm going to take the information real time. So that is a cross-sectional study. And the second one is basically your longitudinal study or the cohort studies. For example, I'm seeing somebody at the age of 5 years, then I saw the same person at the age of 10 years, then I saw the same person is the 10 or 15 years. So surprise. Uh, so we are studying the same population after a certain period of time. Okay, and whether we are saying whether with age, whether the things improves or baddens. For example, uh, for example, like suppose you have got vitamin D deficiency, I took your DEXA, we did a DEXA at 0.5, 0.10, 0.12, and 0, we take on the 16th weeks, okay, 0 to 16th week. So you give a protocol for 16th week. After 16th week, you come to know that what must have taken place, and what changes that you can see in that person, depending on the type of information you have. So here we have got either the cross-sectional study or a longitudinal study.
Mm. Okay, sir.
Okay, clear?
Yes, sir. Yes, sir.
And so that's why I said observational design can be quite exploratory, because they are not in details, but they are also suit the what type of information that we are going to give. whatever phenomena is there. And in descriptive design, basically we used to formulate a particular type of a design, or a hypothesis is there. So based on hypothesis or based on assumption, we are trying to user data, user text. We need to see how much the results are going to be beneficial, or how much, what type of information do we get, what is the implication. And if we are trying to do an analytical research, then we need to test the hypothesis, small or big area, depending on whether we have a whether we are having a cohort of that sort, whether we are having data which we can see every 2 months, after 2 months. So which will give us a nice idea, because it is quantitative in nature. Is it clear? Yes. Is it clear?
Sir, can you please repeat? I got disconnected due to internet error.
So here I told you the different types of observational design are exploratory, descriptive, and analytical. Exploratory means where we explore about, and the knowledge is really is baseless, because we are just still explorating. The second is descriptive, where you describe a data, like what is the mean, mode, median, what is the normal value which is coming, why it is coming, what are the different types of data. And then based on this, we try to do a cross-sectional, depending on whether you are taking the data today, tomorrow, and what type of condition, and how the information is going to describe the condition. The last is the analytical study. The analytical study is the most important, because here you are trying to analyze the various data depending on what type of information you want to seek, and accordingly we are going to do it. So
Okay, sir.
exploratory, descriptive, and analytical. Okay.
Yes, sir.
Yeah. And then as far as the observational design is concerned, we have got different design. For example, the case report, the case series method. As far as the cross-sectional study is concerned, it is again observational design, hybrid model, where we can use different type of cohorts. And then we have got incomplete models. For example, we have got the ecological data, and there is a case crossover data. So there are different types of data which can be used. So as far as the clinical case series is concerned, what is it? It is usually a coherent and a consecutive set of cases of a disease. For example, after having inflicted from the disease, the person is collecting different type of data, and the trying is to see what is the impact of the exercise or the diet over that particular type of data, and how does it influence it. Okay, because they are derived either from practice or from other healthcare institutions. So whatsoever is the practitioner in the uh, medical science, we are going to evaluate the same. For example, in hospital, we are saying one COVID case is a different type of a strain, and then you try to describe it in those terms. Okay, that's why it's called a clinical case series. Then similarly, there is a case series method, where the case series is a register of all different type of cases. For example, even the same case but different, with a different nature, for the different cause, and which is based on again different type of case series. And together, when they know, when they join together these things, it becomes, you become knowledgeable about that certain disease. And then clinical case series are of value in epidemiology. Why? Because they are helping us to study the symptoms and the signs. They are again creating different type of case dimensions, and then they are also creating our clinical education as well as for the audit and the research. So these areas they can be used. Is it clear?
Yes, sir.
And then there are population based surveys, because I told you, like public health, we are basically emphasized upon the population of a group. Even in the hospital, the hospital is related with the population of a group. So in a clinical case study, when we define it in terms of a particular area, when it is defined in terms of particular population, the different type of, then it is known as the population based case series. If there are other types of other calamities or risk factors or the diseases, then we may have a different type of information, depending on whether we are suffering from NCTs, okay, non-communicable disease, or there is a hospital service utilization. So these can be important in order to understand the population series method because it is based on a larger population. Is it clear?
Yes, sir.
And then there is a, whenever a case series happens, then there's a natural content, there is a natural history of the disease, okay? And then we try to understand those phenomena, how they are correlated. Then based on this, yes, based on this, there could be a population case series, which is a systematic expansion or an extension of this series, which includes an additional cases. For example, there are people who are both dying and there are people who are not dying. Okay,
Yes,
so
sir.
you take a series of people who are dying and who are not dying. So those people who are dying in COVID, for example, what made them die? Whether it is the respiratory failure, it was any other problem, it was infection. So you try to understand the same phenomena, and by doing certain research, you are able to find out the real cause. Is it clear?
Yes, sir.
Okay. And then we use full epidemiological use of the case report data, which can be used in different forms. Okay, and then we have got the case series method, which we provide a key and trial balance. So you will get a control and a cohort studies of the various conditions. Okay, they, you can also define a particular disease and you try to capture the data from those disease, and then you compare it in terms of the health status and the population level, in other words. So these are very important aspects as the case series of the method is concerned. And then as far as the interpretation is concerned, we need to understand like what are the key aspects from any study. For example, what is the diagnosis, what is the mortality rate. Okay, similarly, we need to understand like what is the death of the person's death. Okay, what is the, so we are using to understand the characteristics of a person, the characteristics of a place. So you are getting all information. And like I told you, always remember, whatever study we are doing, we are trying to collect data. Why data is being collected? Because data helps us to get information. Information has to convert into knowledge, and knowledge has to convert it into wisdom. Okay.
Mm.
So
Yes,
that
sir.
is the purpose of collecting the data. And then we have got the cohort design. Like I told you, you are trying to see the person with and without the particular thing. So suppose there are people who are suffering from osteoarthritis and there are people like me. Like what are the salient points that why the person is having difficulty in mobility and why the person is having difficulty in talking. So these are the different aspects that we need to see in a population when we try to evaluate the uh, additional data from the case study. Is it clear?
Yes, sir.
Okay. And then there can be certain aspects where the whole population may not be corresponding to the option or the population that we are basically looking at. So the disease pattern can have various aspects. For example, in terms of your disease parameter, in terms of the society environment. So these play a very important role. Okay. And for example, we are having this one now in Delhi, we have got huge pollution. So what can be the various methods, effective methods for reduction of the means pollution over in that particular area. So we can discuss or brainstorm regarding the same. Okay, so we can have interview, we can see, we can also take aspects from the various aspects of where we are living, where we are working, which type of population we are catering to, and what are the successful factors. Is it clear?
Yes,
So
sir.
we can, okay. And then there are cross-sectional studies. Like I told you, in cross-sectional studies, you have got basically the various characteristics, the merits, you have got the limitations, because you are doing a cap analysis. You are trying to see the knowledge, attitude, and practice of that person. Okay, how they are correlated to you, whether they are not doing anything, and whether you can measure the odds ratio by which you are accepting and by which you are rejecting the things. Similarly, you have got merits, you have got demerits of doing the study. For example, you have got which is feasibility of the study, and then based on whether there is a quick understanding of the same, which allows for the different type of disease. So these are basically the benefits of your this one uh, of your community health studies or the cross section studies. So it will give you that point information regarding that particular group. Is it clear?
Yes, sir.
Okay. And then based on this, we can calculate the odds ratio. Similarly, we have got the case control state. Now, how it is different? Because here we have got a control apart from the case. So here you can have a person where you have already studied the case and you trying to see the differences in terms of the you are trying to see in terms of the control. So for example, if there is no control, then what will be the effect, how it is going to be affected? So as a result of which these are known as case control studies. Is it clear?
Yes, sir.
Okay. And then we have got the cohort side, like I said, wherever there's an ambiguity, we don't know, and then we can pull these things in order to understand the risk ratio. How much is the risk of, for example, if you have somebody smoking, then how much is the risk that he or she is going to develop the cancer? So they, based on this, you can calculate the risk ratio or the relative risk, okay, by which we can predict the various things. Is it clear?
Yes, sir.
Hmm. So with this, we have completed up to 33 slides. In total, we have got 53 slides. So rest 20 slides we are going to do in the next class, right?
Okay, sir.
Yeah, so we have completed till 33. Next class we are going to, so rest 20 we are going to do these slides, and then we'll come to the other topic. Okay.
Okay, sir.
So I will share this slide to you, and then I will ask Tawfiq to share the slides to you. Okay. So
Okay,
that you
sir.
understand. Okay, bye.